Borderline personality disorder is a persistent pattern of instability in emotions, self-concept, and interpersonal relationships, typically beginning in early adulthood and accompanied by marked impulsivity. This disorder significantly affects quality of life and is associated with a high risk of suicide and self-harm. Diagnosis requires the presence of at least 5 of the following 9 symptoms, manifested across various areas of the individual's life: intense and obsessive fear of abandonment, real or imagined, and frantic efforts to avoid it. A pattern of unstable and turbulent interpersonal relationships, oscillating between extremes of highly idealized and highly demeaning, splitting. Identity and self-concept disturbance, marked instability in values, goals, and self-image. Impulsivity in at least 2 high-risk areas, e.g., reckless spending, risky sexual behavior, substance abuse, dangerous driving, or binge eating. Recurrent suicidal behaviors, suicide attempts, or self-harm, as a means of emotion regulation. Mood instability, rapid mood shifts, usually lasting a few hours, occurring in response to interpersonal stresses, fundamentally different from bipolar disorder. Chronic feelings of emptiness, an inner void that cannot be filled by any emotional or cognitive content. Intense and inappropriate anger, or difficulty controlling anger, verbal or physical aggression. Transient paranoid ideation or dissociative symptoms that appear temporarily in response to stress. This disorder results from the complex interaction of 3 main factors. Biological and genetic factors. Heredity plays a significant role, with impairments in brain systems such as the amygdala, emotion regulation, and prefrontal cortex, impulse control, as well as imbalances in neurotransmitters like serotonin, observed in these individuals. Psychological and developmental factors. Based on object relations theory and self-psychology, COET, this disorder originates from a failure in self-development during childhood. Due to emotional neglect, abuse, especially emotional, or rejection, the child never forms an integrated self with stable self-esteem. Environmental factors. A history of childhood trauma, sexual, physical, and emotional abuse is one of the strongest risk factors, affecting the stress axis, HPA, and attachment system through epigenetic changes. 3. Defense mechanisms and specific behaviors. Predominant defense mechanism, projective identification. The individual projects intolerable feelings, anger, shame, onto another person and, through their behavior, compels that person to experience and express those same feelings, thereby confirming their paranoid beliefs. Inability to tolerate aloneness. Loneliness is traumatic for these individuals, and they desperately seek relationships, even toxic ones, to escape confronting their inner emptiness. Disordered sexual behavior. As one manifestation of impulsivity, this occurs to fill an emotional void, reduce tension, or prove their fragile attractiveness. Pervasive anxiety and panic. The core anxiety in this disorder is separation anxiety and fear of rejection, which can manifest as panic attacks or generalized anxiety. Borderline personality disorder is a disorder of the integrated self, rooted in a neglected childhood, manifesting in adulthood through chronic emptiness, emotional storms, obsessive fear of abandonment, and self-destructive impulsive behaviors. Although its diagnosis and treatment are complex and it often co-occurs with other psychiatric disorders, with targeted psychotherapy and appropriate support, the path to recovery remains open, and hope for life and inner peace is more attainable than it may seem.